Welcome back again. Here in this presentation we will try to discuss one of the very important topic that we most of the time encounter in our clinical practice is a diagnostic challenge. Alright, so what to do when in the clinical dilemma on a certain initial diagnosis or very difficult diagnosis. So we'll try to figure it out, try to discuss some pearls in clinical diagnosis. Welcome back. I'm Dr. Ravi Kumar Sharma, pulmonologist and critical care consultant, currently working here at Bhopal. So let's start. What happens many times while in the patient care, we face challenges for the diagnosis and appropriate management. In such situations, certain tips and certain pearls in clinical medicine can help us to reach the diagnosis. We all know that old traditional teaching says that the history taking remains always a great tool in patient management. That always remains a great tool. All right. Now in practice, we come across some patient with multiple comorbid conditions and having overlapping symptoms. For example, shortness of breath. It's a common symptom for cardiovascular and respiratory disease. So in such scenario, problem arises to differentiate whether this symptom is due to respiratory or cardiac problem. And we know fever is always a great masquerader in numerous medical conditions. Fever can be even starting from the viral illness to the malignancy. So it's as a host of diseases which manifests as a fever. So it is a great masquerader in clinical medicine. So what to do in such clinical situation? Always, this is the pearl, always remember taking a good history, clinical examination, and then figuring out the probable diagnosis and provisional diagnosis, and then we have to plan necessary lab investigation as per the clinical history and examination. So how to proceed in such complicated clinical situations? Yes, when we are confronted with the subclinical complicated situations, in that even we have some clues, some pearls that if we approach in this way, there is a high chance that we can arrive a most possible diagnosis for the presenting symptoms. All right. So let's start. Number one, what I say and what we should approach is a cardinal symptom approach. What does it mean? Cardinal symptoms, simply the most important symptom that leads to a diagnosis. It means cardinal symptoms are very, very specific to a particular system. Okay, and cardinal symptoms are very peculiar and specific to a particular system. We should always remember cardinal symptoms of a system. And you know, it's very good news that yes, cardinal symptoms are very few and very easy to remember. So what are these cardinal symptoms? To understand the cardinal symptoms, let's have an example. One scenario: a middle-aged patient complaining of seizures and loss of consciousness. In this patient, first thing that come in our mind that this patient might have some pathology related to his central nervous system dysfunction. Although he may have seizures and loss of consciousness because of so many reasons, but whenever we have a patient presenting like this, we think that his CNS, central nervous system, may be at fault, leading to these symptoms. So these are the symptoms which are very specific for a particular system, are called cardinal symptoms. And there are a few cardinal symptoms like, for example, in central nervous system, seizure, severe headache, hemiparesis, hemiplegia, muscle weakness, speech problem, mental retardation. Cardiovascular system likewise, precordial chest pain, chest heaviness, palpitations, dyspnea. For respiratory system, cough, sputum, hemoptysis, dyspnea, wheezing, chest tightness, fever. So these are all typical of respiratory system. For abdominal system, hematemesis, that is a coughing up, it's a hematemesis, molina, hematochezia, and jaundice, abdominal pain, and abdominal fullness also. What is hematemesis? It is a vomiting of altered blood. Okay, and that has origin from the GI tract. All right, and melena is a passing of black tarry stool. All right, hematochezia is the fresh bleeding per rectal. All right, jaundice we know, yellowish discoloration, abdominal pain and distension. What about urinary system? Burning micturition, flank pain, flank mass, nocturia, urinary hesitancy, sense of incomplete evacuation. For reproductive system likewise, menstrual irregularities, hirsutism, dysmenorrhea, menorrhagia, decreased libido, impotence, infertility. These are the very few typical and cardinal symptoms of reproductive system dysfunction. Likewise, for musculoskeletal system, muscle weakness, muscle atrophy, bone pain, bone swelling, difficulty in walking on climbing stairs sometime. For endocrine, hoarseness, lethargy, weight gain, weight loss also, palpitation, sweating, they all have some, we can think that yes, endocrine system could be at fault leading to this kind of symptom. For integumentary system, skin discoloration, loss of hair, nail changes, skin changes. Lymphatic system or for immune system, there is a recurrent sinus infection, urticaria, allergic symptoms, poor wound healing sometime. All right. For lymphatic system, recurrent sinus infection, urticaria, allergic symptoms, poor wound healing. So these are the typical cardinal symptoms of a particular system. We should remember all these things, right? So with the idea of cardinal symptoms, our approach will be directed towards diagnostic workup for that organ system concerned. If a patient is presenting to us with a typical cardinal symptom, so we should think that yes, this first system could be at fault, could be causing his problem first. Then our diagnostic workup, our approach should be focused towards that system first, and we should try to explain those cardinal symptoms from that system only to be initial, in the initial workup. But if at all, if it is not explainable with that system, then yes, we have to look for the other causes, other system dysfunction causing to that symptom. All right. So let's understand this thing with a case scenario. Our approach here is to what we are doing, symptom to diagnosis. Symptom is for patient presentation and diagnosis is our job. All right. So let's see one case example here. This is a obese male guy, 50-year-old male, known diabetic. Here we can see on hypertension or regular medication for last 10 years, still uncontrolled, 160/110 blood pressure, coming to OPD with increasing shortness of breath for 1 month duration with precordial heaviness and sometime, and which is relieved with the rest. Okay, and there is no past history of any cardiac events, no history of fever, no cough with expectoration. All right. So what are these cardinal symptoms? Cardinal presenting symptoms in this patient is, one is precordial heaviness, second is shortness of breath, which points towards a serious problem. All right. And since this patient is having dual risk factor for ischemic heart disease, he is having diabetes, he is hypertension, so he may be developing ischemic heart disease. Okay. In such patients, serious workup to be done properly to evaluate ISD first. So this is the approach we should apply in a clinical medicine to diagnose a patient. Okay. So cardinal symptoms provide a gateway to enter in the magical world of signs, symptoms and diagnosis. We should pick up a cardinal symptoms and we should try to explain, try to figure it out, his problems, clinical signs and diagnostic workup also. All right. So in this way we can have a good idea how to approach, and this is very important, especially in a clinical, complex clinical scenario. We will discuss few more points, another approach also, some new important tips, new pulse also to diagnosis in a medicine in the part 2 videos. So that will be coming soon. Thank you so much. And if this is video is sharing some information, it is improving your knowledge, like the video, comment and share among your friends, among clinicians who are involved in the clinical diagnosis and the patient care also. Also subscribe the channel and put the bell notification on. And if you have any particular topic suggestion, just put in the comment box. We will try to make a simple and understandable video on that topic also in future. Okay. Thank you so much. Thank you.